Hi guys, it's Sarah again. Today we're going to be doing Chapter 8, Medication for Mental Disorders, pages 161 to 164. So mental disorders they used a medicine model to talk about them and define them. And mental illnesses seem to imply a model of behavioral disorder or dysfunctions. And according to the medicine model, patients appear with a set of symptoms, and then using these symptoms, you create a diagnosis. And then once the diagnosis is determined, you can determine the cause as well as a cure. So the medicine model guided a lot of the current thinking about behavioral disorders, and it supported the fact that psychoactive drugs can be effective in controlling symptoms of behavioral disorders. So mental disorders are classified using the DSM-5. This manual provides criteria in order to classify mental disorders. So then the book goes on to talk about several of the disorders. One of them is anxiety disorders. So this is an unrealistic worrying, resulting in chronic uneasiness, fear of impending doom, and bouts of terror or panic. It interferes with daily life, and there's also physical symptoms sometimes. This can include the flushing of the skin, dilated pupils, excessive sweating. So obsessive compulsive disorder and PTSD used to be under the category of anxiety disorders, but they no longer are. And we tend to think of anxiety as a behavior symptom, not an actual internal state that causes a disorder. And they use SSRIs to treat anxiety. The second disorder that was discussed is psychosis. So this is a major disturbance of normal intellectual and social functioning. So basically you have a loss of contact with reality. Psychotic behavior can be viewed based on symptoms that have many possible causes. And an important distinction between organic and functional psychosis. Organic psychosis is caused by physical things. So this could be brain tumors, endocrine disorders, neurological diseases, alcohol use, high doses of stimulants. On the other hand, functional psychosis, it has no known or obvious physical cause, and it usually is called schizophrenia. This is also known as shattered mind. The final part of this chapter talked about mood disorders. So mood disorders, usually these people appear depressed or may exhibit manic symptoms. So an abnormally low mood, and then sometimes mania is abnormally high. But it does depend on which type of disorder. So for bipolar disorder, someone with this will experience at least one manic episode, and then it'll be coupled with alternating periods of depression, while someone with major depressive disorder isn't going to experience manic episodes, but only depressive ones. Okay, this is my chapter 8. Thank you again for listening, and I hope you guys had a great weekend, and I'll see you next week. Bye.